Oh dear God, I am so glad you are here. This patient is so sick and he needs to get to your hospital as fast as possible. I don't know what else we can do for him here.
Well, hello to you too, Dr. K. So what exactly is going on with this patient today?
Well, you see, Mr. Johnson came into our ER about 14 hours ago with a bad headache and low blood pressure. So after a full exam and some x-rays, I diagnosed him with an acute sinus infection and appendicitis. When I looked at Mr. Johnson's medical records, I noticed that he has a history of hypertension, so I ordered a nurse to start an IV and give him his normal 15 milligrams of low-pressure and some Dilaudid for his headache. After he got the meds, he must have become very comfortable because he went to sleep.
Ah, I see. So why exactly did you call if he has been here for nearly 15 hours now? And you said his blood pressure was low. How low is low? Also, what size IV did you start?
Well, when he was triaged, his blood pressure was 72/34 and his heart rate was in the 40s. But that was because he had a bad headache, and I thought that I would fix that with the Dilaudid. The biggest IV that the nurse could get in was a 24 gauge, as he is a very hard stick. I would have put in a central line, but I do not know how. The reason why I called you was because he became hard to arouse and his blood pressure is still in the 60s. The reason why we waited to call was because we needed to try some fluid challenges on him, but they haven't seemed to work very well.
Okay, so how much fluid has he received so far?
Well, when we noticed that his blood pressure was still low, we gave him the first 2 liters. When that didn't work, we gave him another 8 or 9 liters. That brought his pressure up a little bit, but then he started having some difficulty breathing. But I had already looked at his chest x-ray and it was clear, so I know his lungs are fine. After that, his pressure was still low, so I ordered a nurse to place Mr. Johnson on 15 micrograms of norepinephrine and 20 of dopamine. Then something weird happened. Mr. Johnson started complaining of chest pain. So I ordered an EKG and it was negative, but I knew something was wrong, so I followed our chest pain protocol. At that time, Mr. Johnson received 3 sublingual nitroglycerin tabs, heparin, aspirin, Lovenox, 10 milligrams of morphine, and was placed on a nitro drip at 10 micrograms. Because he had already been given the low pressure, we decided not to give him any more. I began to worry that he was not going to be able to maintain his airway, so I decided to RSI him.
Okay, then what happened?
Well, then we gave him the RSI medications and intubated him. The problem was that he was a very difficult intubation and it was a bit dramatic. It took me 3 or 4 attempts to get the tube in.
Only 3 or 4 attempts, huh? Are you sure it was only 3 or 4? It looks like it might have been more. There is blood everywhere and one of his teeth is stuck in the suction tubing. So what medications did you use during the intubation?
Okay, so it was more like 8 or 9 attempts, and yes, I did break all of his front teeth out, but I did finally get the tube in. As far as the medications that we used for the RSI, we used 25 micrograms of fentanyl to sedate him and gave him 200 of succinylcholine. We have placed him on a vicuronium drip for sedation and it has been working great. He hasn't even moved. We put a Foley after the intubation but have only gotten 40 milliliters out so far, and now we have had to suction his tube quite a bit because there has been a lot of pink sputum coming up for some reason. We also decided to give him 40 milligrams of furosemide in an attempt to get some more urine out of him. But that hasn't worked either, and just FYI, he looks a bit swollen to me. This is new since he arrived here in the ER.
Okay, I have heard enough. I mean, holy fucking shit, lady. Did you not like this man? Did you have something against his family or something? I now understand why it took you 15 hours to get us up here. I took you that fucking long to do everything in your power in an attempt to kill this man. I mean, fuck me. You attempted to sedate him to death, drown him and blow up his heart. What veterinary school did you get kicked out of before you decided to become a witch doctor? Actually, scratch that. Witch doctors might actually help the patient. Did you do your residency training with Dr. Kevorkian? I mean, Christ on a crutch, woman. I am surprised that anyone survives here when you work on them. If I can give you one piece of advice which might save you some time on your next patient, just hand them the grenade and pull the pin for them. It will be much more humane than what you have managed to do today. Now leave my partner and I to try and fix your fucking disaster. And go get me some coffee. And a scone. And just for your information, you dumb wombat, Vicuronium is a paralytic, not a sedative, you blethering fucking idiot.
Good. So you can fix him. Thank you for coming. I would love to stay and chat, but I have a lady with a broken foot I need to tend to.
Holy Christ. I would tell her to run. But she doesn't have a chance with a broken foot. Oh well, I guess it will be another confirmed kill for you.
Thanks again for coming.
Go fuck yourself, you moronic idiot.